I'll welcome our online visitors to the Homes Committee for November the 12th. Any declaration of pecuniary interest stated now? There is none. We have two action items with Charlie here with Gateway. Okay, Charles.
Okay, the first action item is in regard to modifying, or please to consider a modification of the new communication system for Gateway Haven. This was presented at the last committee meeting. And in further review of the RFP and this specifications or the specs of the new communication system at Gateway, it was realized that we need to revisit the cabling and add extra cabling to the work order or the installation of the new communication system. And to the tune, I think it's up $89,000, $84,000, stand to be corrected there, ladies and gentlemen. And what the recommendation is please, is that you would consider, revisiting the estimated cost of $275,000 for this communication system to be $359,000. And this additional cost will be internally funded as the other approved $275,000 over a 10-year period in the Gateway Haven budget.
Any questions on this for Charlie? Right. Well, you got the recommendation there in front of you for $359,000 spread over 10 years for the new communication systems. I need a mover and a seconder. Moved by Janice, second by Mike. All in favor? Any opposed? It is carried. Next, we have the purchase of CD player and a payment for the Christmas entertainment at Gateway.
Thank you very much, Mr. Chair. And the request comes to purchase 5 CD players for the residents' use at Gateway Haven to the estimated cost of $300, and a payment of $300 for entertainment at the resident family Christmas event this year to be approved. And these monies would be classified as expenditures funded from the Gateway Haven donations reserves that have been designated for recreation and leisure programming.
Any questions on this? We have the recommendation there for 5 CD players at $300 and $300 for the Christmas entertainment event. I need a mover and a seconder for that. Moved by Mitch, second by David. All in favor? Opposed? It is carried. Next, we have 3 information items.
Yes, the first one, Mr. Chair, do you want me to proceed?
Yes, definitely.
Is my information report. And I do want to just highlight that the staff mandatory training days were very, very successful this year. They took a bit of a different format in that they were only held for half a day as opposed to a full day of training, and the other half day was completed on the internet through our Surge Learning program. And the staff throughout the last year have been monthly going in and completing mandatory modules. We had our theme this year to be Together We're Better, and it was really quite an excellent day. The other thing I just want to definitely highlight as well, we recently, very, very recently, congratulated and certainly applauded one of our staff persons in the person of Steve Desborough. Stephen has been with us for 40 years. I said to Steve at the celebration we had, Steve, you must have come here from kindergarten. And he has been an exceptional employee, and we honored him with a big celebration at Gateway Haven. And you will note in the report there's a picture of Steve, and a number of former retirees came to applaud Steve as well. All of these people work very closely with Steve. Steve is a healthcare aide, And he has been always focused, and I can say this without exception. I've worked with Steve for the last 11 years, and in each and every instance at working at Gateway Haven, he has had the ultimate attention on the residents. Residents has always come first with Steve, and I personally say to you, he has been an exemplary employee. So I just wanted to make sure that you noted that. I'm sorry, I thought my microphone was on. Did you all hear me? Yes. Thank you. And that's it from that, Mr. Chair.
Okay, next, item B, Ministry of Health order.
Yes, basically what I have done is I've just provided each of you with a copy, the public copy of the recent one order that we received from the Ministry of Health and our resident quality inspection that happened this year, and before you, and posted on the internet, of course, for the public on the Ministry of Health website. This report will appear, and folk are able to read it through to find the reportings and the order. I want to just say that the Gateway Haven has already met the response to the one order, and the Ministry of Health has not been back yet to review that and follow up. They can come any day, we're all ready for them. And the quality report, or sorry, the inspection that had, I think it was a total of 14 findings. They were very minuscule, very not earth-shattering, far from it. Most of them had to do with bringing reporting mechanisms and certainly care plans in line, and that has been corrected, and we have a written plan for correcting all of those, and that has been submitted to the ministry. So I just wanted to report on that.
Good. Is there any questions on these three items? Go ahead, Mike.
Thanks, Mr. Chair. Just a note, Charlie, in the written notice number 6, it says they failed to ensure that all hazardous substances were labeled properly. Is that a different requirement in homes than the WHMIS legislation? So,
yes.
So you've got two sets of labeling requirements, one through workplace hazards, WHMIS, and another one through homes? So,
no,
okay.
That came from an incident. I'd like to explain that. That came from an incident that on one of the housekeeping carts, there was the cleaning solution, which was the, let's say, the spray. I think it was the window wash. I don't know what you call that thing, but anyway. And it was labeled for WHMIS, but it wasn't labeled as hazardous. And the ministry, we did meet the requirement for WHMIS, but the ministry felt that we should have, because it was opened and it was accessible to the resident at the time, because it was right there on the cart in the hallway, the ministry felt that we should have gone the extra mile to label it that it was hazardous, not to be swallowed. Yes, that's exactly my reaction, but we have labeled all of our bottles to say not to be swallowed.
Mm-hmm. Any further questions? Do you have anything else, Charlie?
No, just to say thank you very much for your continued support and look forward to the future.
Good. Okay, the last three items are for information purposes, and I need a mover and a seconder that we now adjourn and meet again on December the 3rd. Moved by Milt, second by Janice. All in favor? We are now adjourned.
Thank you very much, everybody. Have a pleasant evening.